Are you a doctor or work for a doctor's office? If so, this message is for you. At the end of the day, I recognize all you're trying to do is help fix the person, bring them some peace, get them cured, healed, peace of mind to them. That's your profession. I get it. So, this video is to let you know about a massive hole within the Medicare community. Some of you might know, but what I've seen, there's a massive disconnect that people are not aware of what's going on here with these Advantage plans or the supplemental plans. So as you know, most people over the age of 65 are in the Medicare world, and they either buy a supplement, Medicare supplement, or they buy a Medicare Advantage plan. Close to 60% of United States citizens are in Advantage plans. Why? Because they're very affordable. Most Americans are living on a fixed income. So therefore, they're trying to pinch pennies wherever they can. One of the areas that they typically do pinch pennies is on their health care. And they find out about these Advantage plans from guys like myself, and they sound great on the surface. And I'd say by and large, they are really great plans, but they do really uncheck a major box, and that is home health care. Even the Medicare supplemental plans have limitations on what they're going to pay out for home health care. Most people are very unfamiliar with what the difference is between medically based home health care and non-medically based home health care. My understanding is that a lot of the Medicare supplements will pay for a good portion of the medically based home health care, not necessarily very much of the non-medically based home health care. I'm here to inform you that there is a product that I've run into in the market, and now I've spent time talking with people like yourself, talking with the home health care service providers, talking with the insurance companies, the insurance agents, the clients. I see the disconnect. Most people don't understand Medicare. No one understands home health care. And let's face it, all patients are in denial. We all think we're invincible until we're not. And then when we're in that desperate position, that's when we start looking into what benefits we have, which is tragic, because that's when we find out we don't have any. Guess what happens after that? You're looking to your bank account. You're talking to your family. What can we do? How can we divvy up the time? Who's going to come in and help? It's kind of this tough situation. People are not aware of the fact that they still have the opportunity to buy a plan if they're under the age of 86. I'm doing this video to hopefully make you aware that you need to educate your patients about this. Send them the link, send them over. We will help educate them. Just let them know that they have an option. It doesn't matter if they have a pre-existing condition. They can have Parkinson's, type 1 diabetics. They can have onset Alzheimer's. It doesn't matter. They can still buy the plan up until age 86, as long as they're not currently in a skilled nursing facility or currently on home health care. So it's important we get ahead of this. Now, any pre-existing condition they may have, they won't have immediate coverage. They're going to have to wait 6 months. So even if you have somebody who does have Parkinson's, tell them to get the plan now. 6 months from now, they're going to be able to tap into some benefits. And here's what's great for those who have supplemental plans. Hopefully, their supplement's going to cover the occupational therapist, the physical therapist to come in, the speech therapist to come in. But guess what? Now we can turn in a claim to this other company I'm referring to, and now all of a sudden that's going to write them a check directly to the consumer. Now they're able to build a fund that they can utilize for whatever they see fit. And many of those people likely need the non-medical based home health care. Still need your sheets cleaned, still need to be bathed, clean the house, fill up medications. Let's help these people that are on fixed incomes create a budget. Hopefully this video was compelling enough to get you to listen to it, and I'd love to tell you more. Please read the website. My name is Lizarraga. I'm with Maximize Asset Protection, and we're here to help.